amri wahlul uqdatam min lisani yafqahu qawli. Starting with the name of Allah, the most magnificent and the most merciful, this is RJ Laraib in the show Healing Hours every Monday and Tuesday. So the timing for today is 2 to 3 p.m. and the topic for today's show is colorectal cancer and other cancer related surgeries. So the guest today with me is Dr. Sohail Haider and he is general and cancer surgeon in a renowned hospital. Assalamu alaikum, sir.
Ji walaikum salam.
How are you, sir?
Alhamdulillah, fine.
Sir, thank you so much for joining us today. And I'm really curious to dive in the knowledge you would be sharing today with us.
Thank you so much for giving me this opportunity on this prestigious platform. Let me say first.
Thank you so much, sir. Sir, please, can you tell that what motivated you to opt this field?
It's a long story, but eventually, let's say I want to be an engineer.
All right.
Prior to the entering into the medical field, but due to certain circumstances, I end up this field. After that, I choose surgery because there is some sort of skill-oriented work have to do while treating the patients. So that's why.
All right, sir. So how long have you been practicing this oncology?
Let's say since 2020 or 21.
All right. So what are your areas of interest?
Especially colorectal cancer,
All right.
breast cancer, and other aspects of the oncological, surgical oncology.
All right. That's great. That's great. So, sir, I'll be moving on towards our topic because we have short time period.
Sure.
So, why are cancers so common these days?
There are certain factors. Let me say that there are broad terminology. There are two forms of factors.
Right.
One is the modifiable and other is the non-modifiable. Modifiable factors, these are factors which are currently run in the genes or run in the family. If, let's say, father or mother has this type of a disease, especially the cancer, there's a highly chance that they can transfer to their siblings or to the offsprings. These are all non-modifiable. That's why we can't change that. The other things, non-modifiable factors, for example, sedentary lifestyle. Nowadays, you are saying that we are in the nation. We used to become very busy in doing some sort of non-physical activities.
Exactly.
Other certain our diet.
Yes.
Processed meat diet, processed meat, and some sort of like let's say the pizzas and the burgers. These are there are other factors like, for example, sunlight. Causing the skin cancers, and if we are not aware to cover our body, then there is a chance of that. So basically, sedentary lifestyles and the diet, they empower a more factor for.
All right. So please discuss some important types of cancers.
Yeah, there are certain each and every cell they can become a cancer because it is important to know what is the cancer. Cancer basically it's non-programmed cells.
Okay.
Allah Almighty has created us and with the organs and with the cells which are very programmed and they run in a very programmed fashion. They used to increase in size and they play an important role and function, and after that they become dead and replaced by the other normal tissue.
Okay.
But if sometimes there are certain changes which can't be controlled by our controlling system, they become increase in size.
Okay.
Basically, this is a cancer. Okay. And when they increase in size, they get their own functionality, and this functionality they play a disastrous role because they are not controllable. For example, they can produce certain hormones which is not controllable. They can exert some pressure effects to the surrounding organs. That's why. So each and every organ, there is a chance that they become cancerous. For example, colorectal cancer. For example, in the breast tissue, breast cancer. For example, let's say lung cancer, liver cancer. There are certain sorts of cancers.
Okay.
Another thing, a terminology, tumor.
Yes.
It's also, and people used to think that if they are diagnosed with a tumor, they said, the death is nearby.
Yes, they ultimately die.
Yeah. Actually, it's not.
Okay.
Tumor, basically, it's a growth of any cell or any tissue, but it is not 100% malignant. Malignant are the cancers, and there are the certain benign ones.
Yes.
Benign means that they are very mild in nature. They can't act as a cancer.
Okay.
So important thing is to diagnose.
All right. All right. Sir, generally discussing how to manage cancer, like treatment, first line option, second line option.
Actually, first is the diagnosis.
Okay.
It's a very long phenomena, long way to diagnose the cancer, and this is particularly halting the patients. Um, Unfortunately, there are certain myths and all sort of we will discuss inshallah.
Okay.
First, the diagnosis on the early stage.
Okay.
So there are certain modalities for the treatment according to the stage of the cancer or the stage of the disease. Stage means the severity. How severe is the disease? How
Okay.
the disease or the cancer has spread to the other organs of the parts of the body or not.
All
So let's say there is a chemotherapy, which is in the form of certain drugs, which is has been prescribed and advised to the patients. There is a surgical options. Surgical means to remove all the cancerous part of the body.
Okay.
There is a radiotherapy. Radiotherapy means certain radiations given to that area where the cancer is present in order to decrease the size of the cells or to kill the cells.
Okay.
And certain hormonal therapies also, depending upon the type of cancer. So it's a long list of modality for the management, and it also depends upon the type of cancers, the severity of the cancers.
Okay. Sir, you've done lots of surgeries and you must have observed lots of surgeries. So, is daily life affected by the surgery?
Uh, yes, some sort of, but it also depends upon the type of cancers and the stage in which the
Okay.
patient presents. If
All
let's
right.
say the patient presents in the early stage, which is also called the stage 1, or let's say the stage 2, and they are treated very well, so it means that they have a full chance of a curation. Curation or curative means that the disease or the whole the cancer has been removed from the body.
Okay.
So they are living happily.
Mashallah.
But if let's say unfortunately if patient presents very late to the doctor, and so unfortunately late means the disease has been spread to the all other parts of the body, so it's been difficult for to treat 100%.
Or to completely remove it?
Yes, can't be
All right.
removed completely.
All
Yes.
right. So, what are the complications related to the surgery or after the surgery?
Yes, there are because let's say the surgery and the anesthesia complications. Surgical complication means let's say the bleeding can't be, which cannot be controlled, or if some part of the body has to be removed. Let's say if there is a cancer of the limb, there is a chance that the limb has to be removed, so the patient becomes crippled. So these are all sort of different complications related to the different types of the cancer, different
Okay.
organs.
Okay. So, the patient becomes immunocompromised?
Yes, patient become immunocompromised after the chemotherapy especially.
Okay.
And yes, the cancer itself is a systemic disease. It's
All
not
right.
localized to that particular area. It also affects other organs some way or other way around. So they play an important role, and especially when the patient get the chemotherapy. Chemotherapy is sort of a treatment for the systemically,
Okay.
and unfortunately, this chemotherapy, these drugs have a certain side effects, so they become the immunosuppressant at that particular time duration, and they need to be care about that.
Okay. Sir, can you differentiate between leukemia, lymphoma, and sarcoma?
Leukemia and lymphomas, these are basically the blood-related cancers.
Okay.
Okay, in certain times the white blood cells they become decreases or they are not produced by the
Body.
Uh, this sort of the leukemias, and certain lymphomas they are basically related to our lymphatic systems.
Okay.
Our lymphatic they are also play an important part for the immune system. So this immune system become affected due to the cancer, they become lymphomas. And sarcomas are basically the cancers to the soft tissues,
Okay.
like the muscles or the bones or some sort of these things like tendons, they are the sarcomas.
Okay. So, how long does the surgery take, and how
Uh,
long it take to recover?
Yes, it also depends upon the type
Type
and
of
the severity of the disease. If let's say the patient is presented in an early stage, so it means that the surgery become very smoothly. There's a highly chance,
Okay.
and without any complication because it is not spreading to the localized or the distant areas.
Okay.
It is just localized to that particular area.
Okay.
Let's say colorectal cancer, it's if it's in stage or early stage, it also it is related to the only so the colon or the rectum,
Okay.
and we have the highly chance that we can remove easily. But if it is spread to the other organs, let's say to the liver or to the other parts of the body, then it will be the difficult and the surgery time is very lengthy at that moment.
All right. So, which tests and imaging scans are required before surgery?
Yes, it totally depends upon the type of the
Cancer.
patient presented. Yes,
Okay.
like for example, in the breast surgery, let's say the breast cancer, we advise mammography or the ultrasound and the biopsy. Biopsy is very much important to diagnose the cancer. Either it's a benign one or it's a malignant one, and the treatment it's also depending upon that. And there is a myth, I tell you, that if uh, there is some sort of a, let's say there is some tumor, and you know that in Pakistan our socio-economic status, our
Yes.
social status, that if you touch that area with the iron, the blade for the
Yes.
biopsy, and it will spread. This is not going to work like that. So biopsies, investigations like radiologically, CT scan, mammography for the breast cancers, and other like MRI, the PET scan. It depends upon the type of cancer. It depends upon the staging purpose, and it depends upon uh, either the cancer is spreading to the other organs or not. So basically, it's also the lengthy procedure, and that's why the people fear about that.
Okay. Does the surgery leave any scar?
Yes, obviously, there is a scar formation at every surgery. Either depends upon the cancer or not, but important thing is a disease-free body.
Yes, disease-free body.
And it is important that either you live with that disease or you live with that scar. And the scar, there is a certain other modalities to decrease that scar. But important is to disease-free.
All right. Sir, what are some major challenges you encounter?
Yes, there's in this setup, like in this country, unfortunately, we are living in a third world country. As the case regarding the cancer, the diagnosis and the treatment is very lengthy and very costly.
Yes.
So cost effectiveness is very much important. And other than that, there are different sort of myths which is circulating, and they are preventing the patients to come early. And they thought, okay, let's say we will.
Like they have superstitious beliefs.
Yeah,
Yes.
superstitious
They
beliefs,
skip
right?
the diagnosis procedure, like you said, like they skip that biopsy.
Yes, yes, obviously. So
Investigation.
that's why the disease pattern become very aggressive, and then
Exactly.
they come for the treatment. So we can't help.
What are some key considerations in providing cancer care?
There are certain modalities apart from the surgery, like let's say I told you before, the chemotherapy, the radiotherapy, family support is very much important.
Yes.
Psychotherapy, so means that the psychology is also very much important because the patient is suffer a lot during the
Yes.
cancer, because whole the lengthy treatment, before that the lengthy diagnosis, so they become very exhausting during
Yes.
that time duration, and there is a fear of okay, it's
Death.
cancer, so means it's
Yes.
death.
Death.
There's no other
Ultimately
way out.
death.
So
Yes.
that's why.
Okay, sir. Coming towards colorectal cancer. First, kindly elaborate the term colorectal.
Uh, it comprises of two organs, colon and rectum.
Okay.
Colon is a large intestine,
Okay.
okay, part of the gastrointestinal system, and the rectum is a end part of, let's say, end part of that system, gastrointestinal, in which the whole fecal matter and the waste matter they become stored, and to the certain limit when patient feels urge
Yes.
to evacuate, then they rush to the washroom or toilet.
All right.
Basically, colorectal, we say the incidence of the cancer at particular parts of the colon and the rectum. So colorectal parts larger percentage as compared to other parts of the colon. That's why we say same terminology, colorectal. But the treatment is are different in the colon cancers as well as the rectal cancers.
Okay.
They are not sort of the same.
So,
that's what.
can they coexist?
Yes, they can be coexist.
So, what would be the treatment modality in that case?
It depends upon either the treatment modality is sort of the same. Same in sense that there is a surgery, there is a chemotherapy, and there is a radiotherapy. It also it wholly depends upon the stage and the when the patient came, and that's the either first go for the chemotherapy to reduce or shrinken the size of the cancer, or straightforward, go for the surgery. Then after that, chemotherapy or radiotherapy. It all wholly depends upon the type of the patient, type of the
And
stage.
stage of the cancer.
Yes.
All right. Sir, can any disease result in colorectal cancer?
Yes, there are certain diseases. For example, inflammatory bowel disease,
Okay.
diverticulitis or diverticular disease. There are road watching. Fortunately, these type of diseases are the incidence of these type of diseases are very less here in our country.
Okay.
But as far as you go for in the West or the Europe, the incidence is very high.
All right.
And these diseases they play important role for the formation of cancer if they are not treated before that.
Okay. Okay. Sir, what is the prevalence of colorectal cancer?
It's very much high, unfortunately, here in Pakistan.
All right.
It has been seen that let's say the incidence is about 6 to 8%,
All right.
and the incidence is alarming raise in the younger population. I have seen in
So
the past.
does it depend upon gender?
Yes, but it's not necessary.
Okay.
I think the major factor it needs to be to do the study.
Okay.
What is the major factor? But I think the major factor part plays an important role here is the sedentary lifestyle. The first I have said,
Okay.
and dietary. I think.
All right. Sir, what are the causes of colorectal cancer? I mean, genetic cause?
Yes, there is a genetic cause also,
Okay.
and there are other causes. I have told you before, like.
Again, sedentary lifestyle.
So yes, these are the lifestyles and
Any comorbid conditions.
comorbid conditions, like if the patient has a certain diverticulitis or unfortunately IBD, this sort of a disease, so there is a highly chance there.
Okay. So, what are the risk factors for colorectal cancer?
These are all different risk factors. These are all same risk factors.
Okay.
They
Same.
can play in one.
Like the rest of the cancer. And what are the symptoms of colorectal cancer?
Yes, this is important. There are certain localized risk factor and there are certain constitutional or systemic risk factor.
Okay.
The symptoms localized is patient they complain some passage of stool during passage of blood during passing the stool.
Okay.
This is the main factor pain symptom.
Okay.
In altered bowel habits, and it means sometimes patient complains of the constipation and sometimes loose motion. They are on and off altered bowel habits. Incomplete evacuation of the bowel.
Okay.
Patient feel or urge to go to the washroom to evacuate, but there is due to the mass, due to the tumor effect, there is no stool, and it run around. Patient become anemic due to the blood loss, and the constitutional symptoms like lethargy, weakness, weight loss. These constitutional symptoms usually more or less present in all sort of a cancer.
Okay. So the hallmark symptom is blood in stool.
Blood in the stool, incomplete evacuation or say urge to evacuate frequently, heaviness or feeling of pain at the lower abdomen or at the left side of the abdomen, this sort of and altered bowel habits important.
Okay. Okay. So how is colorectal cancer diagnosed?
Diagnosis starts from the history, in which the patient told you about the symptoms, the clinical examination in which we perform certain proctoscopy or colonoscopy. In the colonoscopy, we see with the scopes like the camera, we can take out the biopsy as well as do the histopathology and the diagnosis. Certain radiological investigations like the CT scan or the MRI or the ultrasound, it wholly depends upon a sort of a lengthy investigation list. But it is necessary to do all this depending upon the scenario and depending upon the surgeon which is seeing the patient and as diagnosed.
Sir, is sigmoidoscopy and colonoscopy same?
No, it's a little bit different. In sigmoidoscopy, it's a small size of scope, let's say.
Okay.
It can't see the whole portion of the large intestine.
Okay.
But in colonoscopy, we perform the colonoscopy and we can see whole the colon, the up to the cecum, the whole large intestine.
All right.
So if let's say there is a mass or there is a tumor at the sigmoidoscope or anywhere in the part of the colon or rectum, sigmoidoscopy should be performed necessarily to see that if there is another tumor at other part of the colon is present or not.
All right.
And if it's present, so it means that the surgical treatment or the chemotherapy, some sort of various treatment, they become changed.
Okay.
So it means that it depends upon the type and severity of the disease.
All right.
So all these investigations should be done for the diagnostic.
Okay. Another diagnostic procedure is fecal occult blood test.
Yes, this is very much important. Basically, sometimes patient can't see the altered color of the stool, let's say the blood in the stool, or if let's say the tumor is or the cancer is present at the right side of the colon, the ascending colon, so they pass very little amount of blood which can't be seen nakedly.
Okay.
But the symptoms, lethargy, weakness, weight loss, and these constitutional symptoms, or if patient feeling of any pain at the right side or anywhere in the abdomen.
Okay.
So fecal occult blood is very much important. They pick up the small quantity of blood.
Okay.
So if there is the presence of that blood, so it means that other investigations should be carried out, like colonoscopy, somatoscopy, and these sort of investigations.
Sir, are these diagnostic procedures all available in Pakistan?
Yes, it is very commonly available.
Easily available in Pakistan?
Yes, all the tertiary care hospitals or the big hospitals, they are present.
And are they cost effective?
Not necessarily, not very much. They are not very costly, and it is very much important for the health. So for the diagnostic purpose, if it has been advised, so it should be done.
Okay. Sir, what should be the screening criteria for a normal individual who has never been diagnosed with any kind of cancer?
There are screening pattern. For example, let's say if in family there is some sort of cancer, especially particularly the colorectal cancer.
Okay.
If like let's say the father or the paternal uncle has a cancer, so there is a high chance that in the offsprings or in the first blood relative there is a chances of cancer. So at the certain age group, patient has been in these particular patients. Patient has been advised fecal occult or the colonoscopy, let's say yearly or every 3 years or every to screen out if there is any sort of any change in the colon or in the rectum or anywhere. They can be picked up, they can be biopsied, and to confirm either it's a benign or it is going towards the malignant one. So the main theme is to identify the cancer if it is present, yes, in early stage. So the treatment can be done and started early, and the prognosis is very fine.
Okay. So which age group is mostly affected by colorectal cancer?
Let's say it is younger age group like 30, 35.
All right. Under 40.
Under 40, yes.
All right. All right. At what age should one start getting screened for colorectal cancer?
If there is family history, it should be under 40 years. Okay. It should be always started in that time duration for the screening purpose.
All right. Now please discuss the treatment options for colorectal cancer.
Yes, I have told there's this sort of a treatment option depends upon the severity and the stage. We have the chemotherapy, radiotherapy, or the surgery is also important. And in certain patients, all three modalities has been used for the better outcome. Let's say if patient presents in the early stage means the disease is present localized. It's not spreading to the other part of the body, and it is not involving the rectum. It is in the colon.
Okay.
So first priority is to go for the surgery, and after the surgery, the chemotherapy, because every cancer, some sort of, they are systemic. They play an important systemically role, some sort of. They are microscopic cells. They can be spreading, which is not seen at the naked view.
Silently, all right, inside the body.
And they can play later on. Again, the cancer appears.
All right. You mean cancer cells become dormant too?
Yes.
All right. And what are the chances of recurrence after surgery?
It also depends upon the type of cancer, because they can be aggressive cancer, they can be mild, moderate, and this sort of the diseases. So if it's the patient presents early and all the treatment modality has been taken out, all the disease has been completely cured, so there is very less chances that the disease will reappear again.
All right.
So that type of patient should be under the screening process in future. Certain investigations to be done on yearly, every 3 yearly, every 5 yearly for certain time duration, in order to see that the disease has come again or not. And for particular time duration when there is no evidence of any recurrence, then can't advise further investigation to do that.
Okay. So in people suffering in the later stages of cancer, like stage 4 or 3, only chemotherapeutic drugs are the option to improve
Uh,
quality of life?
yes, well, we have a surgical option also.
Okay.
But chemotherapy basically, because in a later stage or stage 3 or let's say in stage 4, it means that the disease has been spread to the other parts, let's
Yes.
say the liver or lungs or any other parts
Yes.
of the body. So only the surgery is not the main modality for the treatment. So chemotherapy should be advised, should be taken. Basically, it will try to kill sort of all types of cancer cells which is present inside the body at every period.
Okay.
And the surgery is important role in also in these patients in order to remove the bulk of the cancer and to decrease the constant source of cancer cells. And if patient has other symptoms like pressure symptoms or let's say the complete blockage of the colon, so we have a surgical option to do some sort of diversion. Okay. Because they can't pass the stool if it be completely blocked. So there is a highly chance for that. So surgery is also an important role in that type of patients also. It's not wholly the chemotherapy.
All right. So like you talked about diversion right now, does it have any complication?
Yes, obviously each and every intervention or each and every, let's say the drug has its own complication. Patient should have to be to do care regularly for the diversion. Diversion means that bypass the passage of the intestine. Patient used to have the bag in order to collect all the fecal matter in that area. It is attached to the outside the abdominal wall, but it is necessary for the patient. So the complication, like it's also surgery. The smell of the patient has to frequently clean and empty that bag, and social norms also social.
Exactly. So what is the life expectancy of patients suffering from colorectal cancer?
It totally depends upon the stage and type of the cancer. If patient presents in the early stage and it has been diagnosed early and treated well, so there is a highly chance that patient will survive more than 5-10 years in more than 95% cases.
Okay. And what about the patients in the later stages of cancer?
Unfortunately, in later stage, because the disease has been spread to all other parts of the body, other organs, so it means that other organs are also affected. So they are not properly functioning that way. Right. So there is a less chance.
All right. According to certain studies, it is evident that colorectal cancer is the third most prevalent type of cancer in the world, and it is the second most death-causing cancer.
Yes.
So, what is the survival rate of patient like in localized disease and then in regional spread?
In localized disease means that it's not spreading to the other organs.
Yes.
So it means that if they are early diagnosis, early pick the disease and they are treated well, so there is a highly chance that they can survive more.
Like absolutely 90% of the chances patient recover from it.
Yes, there is more than 95% chances. But if it's a regional spread, it means that it is spreading to the surrounding organs, spreading to the, let's say, the liver, or let's say in the lymphatic system. If it is present in that, so it means that there is a highly chance they can spread to the other parts of the organ. So at that stage, let's say it's a stage 3 or let's say it's stage 4. So it's been difficult to cure that. So that's why the survival rate is very less in these type of patients.
All right. Then how can colorectal cancer be prevented?
Similarly, like the same factors.
Improving lifestyle.
Yes, if we have to change the lifestyle, regular exercises, we have to discard all sort of a processed food, and these are all different.
All right. Sir, what are the side effects of colorectal cancer treatment? From chemotherapy.
Yes, there is a side effects of the chemotherapy or effect of the surgery. Let's say if there is a different way of surgeries, different options. Let's say if it is present at the at the lower level of the GI system, and involving it means that the cancer is in the rectum and it involves the sphincters which control or block the fecal matter. So if we perform the surgery, so it means that we can go for abdominal resection. It means that we have to remove all part of that area, all part of the sphincters, and they are permanently diverted for the fecal matter. So it's a different entity. So it depends upon what type of cancer, where the location, and what is the stage.
Okay. What are the most common adverse effects of anti-cancer drugs?
Like chemotherapy, during the start of the chemotherapy, let's say the hair fall, which is very much common, nausea, vomiting, they are very common, they are very side effects of that. Immunosuppressant is also very common, and due to that immunosuppression, there are also some sort of viral infections, they are prone to that. These are different.
So do you treat those adverse effects?
Yes, if patient has these effects, we have to treat them systemically also.
Okay.
For certain time.
So are those patients on supplements too?
They can be they supplement because due to that they are not feeling well and they are not nutritionally very poor, so the supplements can be used and should be used.
Okay. Again, any alternative or complementary treatment which can be used for the cancer?
Certain, let's say, hormonal therapies or some sort of, but it depends upon the cancers. Certain newly investigation or new studies or new some sort of modalities should be adopted if relevant.
Okay. Any success stories, sir, related to colorectal cancer first?
Yes, actually there are a lot of stories. Let me remember, yes, there is a patient, very young female patient.
Okay.
And fortunately, she has reported to us in our setup where I have been working. And she has been diagnosed in very early stage.
Okay.
But the important and the difficult one is that the cancer is lying very lower at the GI tract.
Okay.
Just near to the sphincters. And we, as a part of our team, we operated upon her and successfully removed that area, and the sphincters has been preserved. It's very difficult surgery, but she is fine now, alhamdulillah.
All right. Sir, sometimes people do not understand what you try to elaborate them. So how do you convince them?
Yeah, it's very difficult due to our social norms.
Exactly.
The myths and all sort of things. But we have to sit with the patient, we have to consult the patient as well as the attendant especially. Similarly, some sort of other modalities we have to use, like some sort of other team members like psychiatrists. They are very good in persuasive.
Okay.
Like that.
So you have healthcare team?
Yes, we have healthcare teams. In our setup where I am working, we have tumor board. And this is a it's not innovative. It is usually working in the Western and all first world country, but here in Pakistan there are very few some sort of these things in which different consultants of the different specialty, they discuss the case in a different aspect and they advise the best treatment option which is available particularly to that patient and advice to the patient. This team includes the colorectal cancer surgeon, radiologist, histopathologist, oncologist especially, medical specialist, psychiatrist, dietitians, all sort of team members. They are very much played a key role for the treatment of that patient. And this should be adopted now in Pakistan, in each and every, I think, in tertiary care hospitals and sort of things, for the better outcome of the patient.
Okay. So do you recommend psychotherapy to the patients?
Yes, obviously, because I told you before that if patient heard that she or he has suffered from cancer, so she become fear, it's now death.
Yes.
There is no other way around. And the treatment option, it's very lengthy, it's not a single based oriented. The diagnostic modalities is very lengthy. Patient has to come in hospital very regularly, very frequently, and if even after the treatment, patient has to go the hospital for the certain investigations yearly, screening purpose. Either the disease has been recurrence or not. So psychotherapy is very much important. Psychotherapy plays post-operatively as well as pre-operatively also plays very much important role for the better.
Sir, how lengthy is the treatment for colorectal cancer?
I have told you because early that there is a chemotherapy. If it also depends upon the stage.
All right.
When the patient presents. Uh, Chemotherapy sessions, long chemotherapy sessions took, let's say, 5 to 6 months. Short chemotherapy, 4 to 6 weeks. After that, the surgery, the recovery from the surgery. Then patient may end up again the chemotherapy sessions. It depends upon the stage. So it took a lot of time.
All right. Sir, how do you keep yourself updated?
Regarding the studies purpose, yes,
yes.
we have to the new things which is going on in the world. We have to read in the journals, all the media, social media, and these are all the different methods.
So
We have
do
to.
you have publications?
Yes, we have publications. We have to do publications. We have to do some sort of a research.
Case reports
Yes,
and
case
case
reports.
series.
Yes, these are sort of things which
Okay.
is present here, and let me say because in our setup, in our country, patient they become fear to discuss in the family regarding the disease.
Yes.
They presented in very large, very advanced stage. So it become very challenging to treat that patient. They are different types of case reports, full of case reports in sort of these things. And the main purpose of publishing and to study this in order to get the better treatment process to
Yes.
better for the betterment of the patient. So it is necessary.
Okay. So what is the current state of your field in Pakistan?
Regarding the colorectal
Yes.
surgery as a medical field, it's very emerging.
All right.
Because it's sort of a subspecialty. The surgeon has to do basic surgical qualification after the graduation. Then after that they have to do in colorectal specialty. So it should be started here though. In the
Okay.
West, in the first world country, it has already established, and we are here in Pakistan. We are as a conventional practitioner.
Yes.
We have foot in, let's say, in all sort of disease. We are
Exactly.
treating all sort
One
of
doctor is
disease,
doing everything.
everything. So it needs to be changed now.
So the number of colorectal surgeons is less in Pakistan?
Yes, it's far less in Pakistan, but now it's the good thing. There's certain organization, let's say the controlling body, or let's say the colleges, and they are now adopting to train the surgeons in colorectal surgery.
Okay, sir. Sir, do you remember any motivated or optimistic patient?
I think it's difficult. There are a lot of patients, but it's.
All right. Some patients are they optimistic about their health?
Yes,
Like they would recover?
Yeah, bilkul. Yes, they are optimistic, but the number is very few.
Hopeless.
Yes.
I've
some
seen
sort of
many
that.
hopeless people.
We need to change that pattern, and you guys in the media, you are working very well, basically in order to
Get awareness.
yes, to get the awareness. And let's say you have heard about the October month, regarding the whole month
Yes.
regarding we for the breast cancer, the awareness program, different type of these should be for the patient, for the betterment, and they should be adopted, and very oftenly and very frequently there should be done
Addressed.
the program addressed.
All right. Sir, have you performed any other surgery?
Yes, yeah. Apart from that, we are performing as our whole team, like in the breast cancers.
Okay.
We have one-stop breast cancer. It's another modality here where I am working in Dr. Baniazi Teaching Hospital. Other sort of cancers like thyroid cancers, other abdominal cancer we are, but mainly we are focusing on colorectal, breast, and this sort of things.
All right. Sir, please, would you like to discuss breast cancer briefly?
Yes, breast cancer, the incidence is high in females,
Okay.
but the male patient also we have seen. Any sort of change or any sort of texture or swelling in the females at the breast side should be addressed,
Okay.
because the incidence rate of breast cancer is very, very high in Pakistan, especially.
Okay.
I think due to the social norms, females they do not discuss their disease or their situation in the family.
Right.
They don't like to discuss due to the social norm to the doctors. So that's why this type of disease, the breast cancer, they have been diagnosed in very advanced stage. This is very
Yes.
alarming.
Because in certain backward areas, the females still do not have access to
Yes,
hospitals.
they do not access to hospital. They don't discuss in the family even. If they discuss in the family, or they should be trained that how they can examine herself.
All right.
So if there's any change, if anything present, they should be consulted with the doctor, and the doctor advises whatever investigation he or she wants to confirm the diagnosis. These patients or females should all should do that investigations to rule out the malignancies.
Okay.
So it's an alarming. We need to aware whole Pakistan, whole country, or whole the nation regarding the breast cancer.
Okay, so what are the causes of breast cancer?
Similarly, apart from other type of cancers, there are modifiable. They are non-modifiable. Non-modifiable means in the genetic. If a mother or a maternal aunt has a cancer regarding the breast cancer, so it means that the genes can be transferred to the female offspring.
Okay.
So it's some sort of same
Again,
ecological
chemotherapy
factors.
is effective and radiation
Yes,
therapy.
it also depends upon the type.
Okay.
Chemotherapy, surgery, after chemotherapy after the surgery, or the radiotherapy, or also the hormonal therapy, because
Okay.
hormones are also important, play a role in
Okay.
formation of the cancer. So hormonal therapy means to if that hormones are excessive in number in that particular female patient, we have to address that.
All right. All right. What is the survival rate? Again, that will be depending upon the
yes,
stage.
and that will be dependent upon the stage. If patient presents and picked in the stage 1, that means the very early stage and treated well, so there is a high chance that they can survive 95% they can survive more than 10 years.
So this type of cancer can recur too?
There is a chances. Basically, all type of cancer, there is a chances that they can recur.
Okay.
Because cancer cells, they are very microscopic level cells.
Okay.
They can be they are present at the particular level, but they can spread via bloodborne or via the lymphatics or some sort of these things. They can spread to the other parts. That's why chemotherapy is important role.
And in case if it's hereditary, then it will recur.
There
There are more chances of
there
recurrence.
is more chances.
Okay.
Yes.
So can breast cancer spread to other parts of body?
Yes. Some similarly like the other cancer, breast cancer can spread to the bones, can spread to the surrounding local regional area, can spread via lymphatic to the other parts of the body. There is a way that can be spread to any place.
Okay. What can be improvement in the diet of a cancer patient?
I think similarly the processed food.
Okay.
Which we are using. I think because they have the carcinogens, they are processed, they are not natural, they are synthetic, man-made. That's why these carcinogens, these chemicals which we are using for the processing, the preservatives and all sort of things, the colors, they are not natural. I think they are important key role which plays for the formation of the cancer later on anywhere in life.
And one should avoid using plastics?
Yes, obviously plastic is also
cancer causing.
Can cause cancer anywhere in the body.
All right. So have you treated any patient suffering from breast cancer?
Yes, I've told you that we are doing one-stop breast cancer. We have surgeons, breast cancer surgeons are also with us, and they are doing a lot of breast surgeries.
Okay, sir, not all surgeries are successful.
Yes,
So does that affect your emotional health?
Obviously, because life at stake. They are patients. They are living humans. But I think it's sort of a training or sort of we are seeing the patients. So I think our emotions should be behind.
Okay.
If we let's say one of my professor told me when we are doing residency or I think the medical school, if we take a stress from one patient, let's say,
yes,
we take some 10% stress, and we can't cope with that.
yes,
Next day, another cancer patient or another patient came, and we take stress more, and the next day 10%. So ultimately, in 10th day, we cover the 100% stress.
Yes.
So yes, emotions are present because they are humans. Or if, let's say, God forbid, if the other person is me, or other person is one of my family
Yes.
members, so what happens? So we have to address like that. We have to think like that, and try to advise the best option, the treatment option.
All right, all right. Sir, any takeaway points?
Takeaway point, yes, it's important whenever someone feel any change in the body, any functionality, any symptoms, don't treat by yourself,
All
or
right.
don't treat by quacks. Unfortunately,
Yes.
it's very much very spreading
Common,
here,
yeah,
here
in Pakistan.
Always go to the doctor, to the concerned doctor, and whatever he or she advises for the diagnostic purpose, please do that for the diagnosis and try to treat early.
Yeah.
As soon as you treat it early, there is a highly chance that the person or the patient can be cured completely. That is the
They are treating early through complementary medicines, basically.
yes, there's some sort of that.
They are going to homeopathic doctors and all.
Homeopathic or say that just say okay, there is a family member.
Yes.
If someone get a headache, they told you, they give you the medicine. Oh, I have a headache.
Yes.
I use this medicine. You can also take this
Yes.
medicine. This is a good. But that headache may be due to some other reasons.
Exactly.
So should be consult with the doctor always, and whatever he suggests, try to that.
All right, all right. Thank you so much, sir, for
Thank you,
joining
thank
us today. Your expertise and your knowledge has enriched our conversation, and I hope our listeners it would have been valuable for them too. And I'm hoping to invite you back soon again, inshallah. Thank you so much, sir.
Thank
All right, listeners, this is RJ Laraib, and I'll meet you again on next Monday. So it's time to sign off. Take care and do a lot of prayer for yourself and for everyone. Thank you. Allah Hafiz.